Hello, I'm Irene Malaty from the University of Florida. I'm a movement disorder neurologist here in Florida, and it's my pleasure to talk with you today and with Dr. David Isaacs, who's an associate professor of movement disorders in the Department of Neurology in Vanderbilt University, and with Keon Sanaie, who is a rising leader with the Tourette Association of America, who is joining us from Los Angeles, California. And today it's our pleasure to talk about the lived experience of Tourette syndrome and exploring the merging of symptoms and treatment. And we'd like to just chat a little bit about what it's like to live with Tourette and how it can be managed when necessary. So tics are movements, including sounds, that can be intermittent, they can be brief, they can reoccur over time, and they can repeat in any episode. A person very commonly feels an urge or a need that makes them have to do this type of movement or sound. And that movement or sound might temporarily relieve that urge. Sometimes people can hold them in briefly, but oftentimes they just will mount and eventually be expressed. Tourette syndrome, according to the DSM-5, is a childhood onset condition with tics that involve movements and at least one sound. And the tics have to last for over 1 year to qualify for a diagnosis of Tourette syndrome. It's named after a neurologist, Gilles de la Tourette, who described some people that he had seen along with Charcot and described the phenomena of people having tics. So Tourette syndrome involves motor in at least one phonic tic or a tic that makes a sound, and it lasts more than a year in someone who's otherwise usually pretty normal. And many people with tics also experience what we call comorbidities or other symptoms that tend to come along with tics. And those can include ADHD, OCD, anxiety. Some people can experience difficulty with strong emotions and difficulty with depression at times. Dr. Isaacs, can you tell us a little bit about how in your practice people tend to present when they first come to see you and what they tell you about their experience?
Sure. Most people first experience tics around the ages of between 4 to 8 years old, roughly. There are exceptions to that. And those initial tics in childhood tend to be very simple tics, often involving the face, head, or neck, or maybe simple vocal tics. So this could include things like eye blinking or making movements of the neck, or clearing one's throat or sniffing. So they're usually very simple, quick, short tics. As people get older, their tics may remain in those body parts, but they may also develop tics in other parts of the body. So now tics suddenly start to involve the arms or the trunk or even the legs. The tics tend to wax and wane a great deal, but in general, there can be if there is a worsening, it tends to continue to worsen until people are around 10 to 14. So in clinic, we often see that there's a peak in the severity of people's tics between 10 to 14 years of age, which we think has to do with the onset of adolescence and puberty. And then for many people, there is a gradual improvement over time throughout the teenage years and into adulthood. Unfortunately, most people still have some tics even as adults, but they're often much less severe than in early adolescence. Again, there's a wide variation, but that's the general trends that we see in clinic.
That's very helpful. And Keon, can you tell us about your own experience and how that kind of matches what Dr. Isaacs just said, or maybe it doesn't?
Yeah, absolutely. Actually, I think quite a bit of it matches up really well. So I began exhibiting tics right around the age of 7. And actually, it started off very, very subtly and was sort of restricted to motor tics above my shoulders. At the time, it was actually a teacher that was the first to notice and flag it to my family. And at first, it honestly comes as a huge shock because to most people, this is something that is really foreign and frankly, really quite strange. So the first course of action was seeing a physician about my tics. Shortly after noticing symptoms, that was probably within the span of a couple months. But it was over the course of the next year that I was referred to a children's neurologist where I received a formal diagnosis after a series of tests. I'll also offer that, over time, the severity and intensity of my tics did increase. and definitely peaked during my teenage years. I began to exhibit vocal tics that accompanied motor tics that also increased in both severity and intensity. And while I don't necessarily have a formal diagnosis for any of the comorbid symptoms, there are certainly behavioral factors that come into play with Tourette syndrome and indirectly or directly impact one's quality of life. To sum it up, you can just say it's a lot of fatigue and a lot of frustration. But overall, I'd say that my tics are characterized as mild, but can vary drastically from day to day. And it's really something like running a marathon that never ends, as it's very taxing physically and mentally to sort of navigate all of the challenges that you have with everyday life, stacking Tourette's on top of it.
I really appreciate you sharing that, because I think you hit on something super important, which is a lot of times we talk about very specific diagnoses and categories of things that we look for, but sometimes we really should be talking about just the experience of tics and how sometimes it's exhausting. Sometimes you trying to suppress your tics or not let them manifest is also distracting, I imagine, and some people share that with us.
Yeah, absolutely. Sorry to cut you off.
No, please. Go ahead.
Yeah, you made a really good point. The act of suppressing tics is really one of the most interesting things about having Tourette syndrome. It creates an entirely new dynamic that I would argue is not experienced by anybody who has never had Tourette syndrome. And it really is sort of a game as you learn to sort of navigate life while someone argues, strategically suppressing tics during certain critical moments.
It's almost like you've got a lot going on in your head when you're, trying to be doing other things and interacting with people, and you've got a lot of active things going on at the same time. Yeah, and a lot of times we talk about the impact of tics, and sometimes it's the obvious part, which are the physical expressions or the sounds and how they can be inconvenient in certain environments, sometimes religious environments, occupational or educational environments, or even in families where sometimes people aren't as well supported as your family jumped right in and got you to a doctor to try to, get you support. But also sometimes there are, as you mentioned, there are fatigue, there are internal emotional responses, sometimes social impact and other things. So all of those are important pieces about when somebody should and if somebody should seek medical attention. And a lot of times we talk about if there's physical, educational, or occupational, or even social or internal distress, it's a good time to look for help. And sometimes people see their pediatrician or primary doctor. Sometimes people see neurologists. Sometimes people see psychiatrists. Oftentimes psychologists are involved too. Sometimes occupational therapists. But, to start with, Dr. Isaacs, when someone does come to you, like Keon, maybe with their family, maybe with their loved ones, maybe not, and they're telling you, this thing is going on, maybe I don't know what's happening, or maybe I do, and it bothers me. So I know in some cases, people don't need treatment. If it's not an interference, we just recommend explaining, understanding, education, and watching. But in Keon's case, it was kind of getting in the way. What would be the first thing you would recommend in those cases?
Yeah, if tics are bothersome, which is thank you for mentioning that, Dr. Malaty, because it really does need to be something that's bothersome to the individual, as opposed to perhaps maybe if it bothers their family but doesn't bother the person with the tics, that's a different matter. But so if someone is bothered by their tics, the first treatment we recommend is comprehensive behavioral intervention for tics, or CBIT is the acronym. And this is a very solidly evidence-based behavioral intervention. It's been studied in several randomized controlled trials involving children, adolescents, and adults, and been shown to significantly reduce the severity of tics. So it's definitely something that we encourage and offer to everyone. The biggest limitation, honestly, for most people is access. People who provide this do have to be trained, and there's a certification process. So, but the Tourette Association has a nice feature on their website where you can actually search for providers in your area. You put in your zip code, and you can find out people in your locale who are certified or able to offer this. And many of them can do it telehealth, which opens up some access to individuals. So when feasible, that's definitely the first line approach.
So in some people, maybe they don't have a CBIT therapist. Maybe they aren't able to do telemedicine with a CBIT therapist, or maybe they've tried it and they've benefited. But at some point, there are some individuals who need medications as well. Sometimes in addition, sometimes in first line. And in the US, currently, we have 3 FDA approved medications that are labeled as being used in Tourette syndrome. One of those is haloperidol, which is one of the first medicines to be discovered to be useful. And in fact, this was a big breakthrough when it was discovered that this medicine reduced the tic expression. And it really made it proven that this was a physical medical condition, not all psychological, because people could see this has to do with neurotransmitters. And when medicine changed it, people realized this is a physical condition that some people have. The other one is Pimozide. And the third one, which is FDA approved in children, is Abilify or aripiprazole, haloperidol, Pimozide, and aripiprazole. All 3 of these medicines work by blocking dopamine receptors. So we call those neuroleptics or antipsychotics. And we think that the dopamine system's on overdrive in people who have Tourette syndrome, and that this helps regulate that. Unfortunately, these medicines have a lot of burden of side effects. So weight gain is very common, tiredness is very common. There are risks of increasing blood sugar and cholesterol. There are risks of tremors and even involuntary movements that can be permanent, which are not tics, that we call tardive dyskinesia. And so we have to think, and even some hormonal potential side effects. So we have to be very careful, and we use these medicines, and with some people with very good benefit, but in some individuals, we have to be very careful because of side effects. Keon, have you had some experience with side effects of medications or difficulty in finding a treatment that was really a good fit for you?
Yeah, definitely. I'd say the process was it was really a lot of trial and error. So the main 2 medications that I took over the course of my Tourette syndrome treatment was haloperidol and clonidine, which I took in various quantities and intervals, sort of experimenting with increasing the quantity over time to see if there was any sort of different reaction. And I took that medication during adolescence, and so really during some of those early years. And I guess what the most important thing to know in this case is that gradually the side effects of these medications sort of became problematic to the point that they impacted my day-to-day life to an extent where the modest improvement in tics didn't really warrant the trade-off, at least personally. And so to give you some concrete examples, these side effects included drowsiness, some dizziness, and overall just a general sense of irritability. I'd say that the drowsiness was really the most difficult, especially when one's younger and maybe a child who's been recently diagnosed during some of those earlier stages in life. It was really difficult to navigate educational settings and things of that nature when you're constantly tired. I'll also note that I explored some homeopathic and non-traditional remedies, which might work for some, but ultimately weren't particularly helpful in my case.
Yeah, and you really highlight an important point that we have to weigh the benefit and the side effects and make sure that the medicine's actually helping you feel better and not worse and not giving you another burden to work against. You also mentioned clonidine, which is what we call an alpha agonist and very commonly used. Dr. Isaacs, do you use this off-label in your practice?
We do, yeah, and in part for the reasons that you and Keon were highlighting, that just because the neuroleptics tend to have so many side effects, first line for tics in our practice does tend to be the alpha agonists, and then we use other treatments as well, topiramate, botulinum toxin, and such.
Yeah, so even though we have some that are labeled, we commonly start with other medicines in hopes of avoiding side effects. Alpha agonists can be useful for tics and sometimes help mild ADHD before using stimulants. And topiramate is a seizure medicine that's used off-label for tics, sometimes even VMAT inhibitors, which reduce dopamine overactivity in a different way by reducing the amount of dopamine that's released at the nerve terminal. And botulinum toxin is an injectable therapeutic that can sometimes reduce the urge to do specific tics if they're very focal, meaning certain areas. In very rare cases, we may even consider deep brain stimulator surgery, which is currently off-label and used in very extreme cases where nothing else works, but can be used to reduce the amount and severity of tics. So, currently we have some things that are in trials. For instance, ecopipam is a D1, D5 dopamine receptor blocker. So it's an innovative neuroleptic in a sense that it blocks only the receptors we need it to block. So there's less risk of that involuntary movement called tardive dyskinesia and better tolerability with less weight gain, according to what we call the phase 3 trial, which is sort of the recently completed trial. And we'll see if this gets FDA approved in the near future. I wish that we had more time to talk about things, but Keon, I'm so grateful for you sharing your story, and I hope we have more opportunity to hear a little bit more about it. For people who want to learn more about the treatment of tics, the American Academy of Neurology has guidelines that have been published summarizing the best evidence, so what has the most evidence behind it. And we thank the audience for their time. I thank Dr. Isaacs and Keon for sharing their time, and it's been a pleasure.
Thank you.
Thank you.